Aloha, I'm Colin Moore, and I'd like to welcome you to another segment of UHERO Focus. Today we have with us Ruben Juarez, who is the newly appointed HMSA Endowed Professor of Health Economics at UHERO and Director of the Pacific Alliance Against COVID-19. He's here to discuss the latest UHERO report. Ruben, what's in the new report?
I'm excited to share the news that UHERO will be releasing quarterly public health reports to our community. In the reports, our team will cover a series of timely topics related to public health and policy. In the first report, we'll focus on the impacts of COVID-19 on Hawaii's populations. Thanks to the support from the state of Hawaii, we were able to recruit a cohort of over 2,000 adults representing the state population. We'll follow them over time to monitor changes that could inform public health policy.
Ruben, what is the vaccination situation in the state so far?
The state of Hawaii has been leading the nation on vaccination. As of today, over 93% of respondents have been vaccinated. In addition, over 85% of vaccinated adults have received at least one booster shot. Although pockets of unvaccinated individuals remain, these numbers are a good reflection of the efforts made by the community to address COVID-19 collectively. We are not done. COVID-19 vaccination rates in children are low, and this is one of the new challenges.
Do we know how many people have been infected with COVID-19?
Yes. For the first time, we were able to estimate that 1 in 4 individuals in the state reported that they received a positive COVID-19 test result since the pandemic started. The true infection rate is likely even higher due to asymptomatic cases. Almost 50% of unvaccinated individuals have been infected with COVID. In addition, individuals who receive a booster shot are 46% less likely to be infected than those who did not. Collectively, we estimate that 96% of adults in Hawaii have some degree of immunity to the virus due to infection or due to vaccination.
How has COVID-19 affected Hawaii's population?
Almost 2 in 3 adults in the state reported a negative effect of COVID-19. 23% had their savings depleted, 18% had trouble with the education of their children, 15% were unable to pay rent, 12% were laid off or had their work hours reduced, and 12% had a friend who died, and 9% had a family member who died. In addition, mental health has been a significant problem in the state. More than 1 in 3 adults reported symptoms of depression. 11% of adults reported low self-esteem, and about 4% of adults in our cohort had suicidal thoughts over the last year. Although likely compounded with other factors, unvaccinated individuals are more likely to experience mental health problems than vaccinated individuals. Finally, food insecurity has been a significant challenge in the state. More than 20% of adults reported low or very low food security. Individuals who got infected with COVID-19 and those unvaccinated experience more food insecurity.
Ruben, long-term effects of COVID-19 or long COVID has recently been covered in the national news. What do we know about long COVID here in Hawaii?
Yeah, long COVID is characterized by having persistent symptoms of COVID-19 even after no longer being infected with the virus. Almost 1 in 3 adults in Hawaii who got infected with COVID-19 experienced symptoms of long COVID. 58% of the symptoms were cough and shortness of breath, 49% fatigue, 48% mental fog or headaches, 25% joint or chest pain, and 24% loss of taste or smell. The average length of the symptoms differ by vaccination status. Unvaccinated individuals with long COVID experience symptoms for about 4 months post-infection, whereas vaccinated and boosted individuals reported an average of about 3 months only.
Ruben, thanks so much for sharing this important information with our community. The data speaks for itself. Getting vaccinated and boosted reduces complications of long COVID in addition to other severe consequences of COVID-19. This is just a small snapshot of the report. For more information, you can access the full report by visiting the UHERO website. We look forward to learning more in upcoming UHERO public health reports. Thanks again for joining us.